Celebrities Wanda Sykes, Angelina Jolie, and Christina Applegate opted for double mastectomies to avoid what they feared was inevitable. Other, less famous women have suffered through traditional breast cancer treatments, many without ever exploring any other options. It doesn't have to be this way. The Hampton University Proton Therapy Institute treats breast cancer. Breast cancer is the most common form of cancer found in women, affecting millions. Roughly 300,000 new cases are diagnosed each and every year in the United States.
My cancer being on the left side, I was really hung up on it being so close to my heart.
I had breast cancer on the left breast, making it even more difficult as far as radiation is concerned. Because in this area, you have to worry about accidentally radiating the heart, the lungs. And with traditional radiation, that's exactly what would have happened.
The advantage of proton therapy for these women is it gives them the benefits of radiation in reducing the local recurrence without the long-term side effects of radiation to the coronary vessels.
And what about those women who went to the extreme, like comedian Wanda Sykes, to have both breasts removed when cancer is found in only one? Was that decision driven by the fear that cancer would also develop in the healthy breast? Well, a recent study published in the Journal of the American Medical Association found that survival rates for breast cancer patients treated with surgery and radiation compared to those who opted for bilateral mastectomy were virtually the same. So along with surgery and chemotherapy, HUPTI provides women an alternative to the mutilating results of mastectomies.
The data that we have published from the institutions that have done this, very exciting, very good results, and very low side effects.
I expected all kinds of burning, all kinds of pain, all kinds of peeling. However, it was no worse than a regular sunburn. And I used aloe vera, that took care of it.
Some tenderness to the skin, but no burns. And the healing was fast. The color of the skin came back relatively fast.
Joanne worked very hard for the Proton Treatment Center for the funding for it because she thought it was very important to the community. She had breast cancer. She was diagnosed in 2005 or 6 and up in DC. And when she got out, came out of the cancer treatment, out of the surgery and all, they said she was totally cancer-free. And then within a year it came back, and it came back with a vengeance. I think she would probably say that there are some things that we could do without, and some things that we need to fund. But certainly she would think that the Proton Treatment Center at Hampton University is one of those areas that need to be funded. It's so important that we have options other than just chemotherapy and surgery.
In the United States, we tend to try to keep our patients within the vertical tiers of hospital integration, which is a fancy word for saying the folks in one hospital system like to keep their patients all within that hospital system. I would hope that my physician would sit down with me and take off his brand and take off his hospital association and speak to me with the honesty of a physician, because that's really what I'm coming to him for.